So the continuation is that here we are seeing the prevalence. So in prevalence we are going to have the attendance rates at OPDs and at health centers also. And prevalence, mainly prevalence is nothing but what here, this indicates the number of all existing cases of diseases we can say. Okay, and coming to here, notification period of prevalence will be having. Next point is notification, which is calculated from the reporting to public authorities. We can say certain diseases like yellow fever, polio, myelitis. So this all includes here information. Okay, and also admission and readmission of the rates, death rates, and duration of stay in hospital, spells of sickness or absence from work or school, hospital data. This all will include the prevalences. Okay, so this is one of the indicator we can say. This indicator will come under the morbidity indicators. And coming to next, disability rate. Disability rate is nothing but what, it based on the full range of daily activities. So means what we can say here, it falls into two categories. That is, one is event type indicators, person type indicators. Event type indicators is nothing but how many days, number of days we are doing activity, bed disability days, work loss days within a specific period. Okay, and coming to person type indicators here, limitation of mobility means here confined to bed. Okay, confined to house. So means what here, which internal means what we can say in our surroundings, means what we can say here, it is confined to bed, house, getting around, and also basic activities of daily living like eating, washing, dressing. So this all will indicate us the person type and event type indicators. And next one we are having over here is environmental indicators. These indicators which will reflect the quality of physical and biological environment. See, we have seen the determinants. So the same thing here we are going to discuss it as a indicators we can say. Okay, so here environment means what we can say, air, water, radiation, solid waste, noise. So which is exposed to toxic is nothing but here what we can say, so many chemicals are mixing in our environment, pollution is increasing. So by this what happens, the substances in food and water what we are taking, food and drink, so these all chemicals means the pollution what is that, it is going to mix on our food, means it is polluted, it becomes poisonous. So because of that what we can see here, pollution will who get safe water, indicators potassium of air, light, any water we can take it over here. So this indicates environmental indicators. Next we will be having nutritional status indicators, means what we can say here, it is a positive health indicator. Newborns we can say birth weight, length, head circumference. So these are all will come under the maternal nutritional status. And next one we can say, in this we'll be having anthropometric measurements, preschool children. One is weight, it measures acute malnutrition. Height measures chronic malnutrition. So chronic is nothing but, I have told you, lung diseases, heart diseases. Mid-arm circumference is nothing but, this is also chronic malnutrition, it is going to come. Okay, next we are going to have here prevalence. Next one is height of the children at school entry, and also prevalence of the low birth weight. So means what we can say here, low birth weight is nothing but less than 2.5 kg the baby is going to born. Okay, height for race, weight for race, and also weight for height, head and chest circumference, mid-arm circumference. So in adults means obesity, underweight, anemia. So these are all considering as nutritional indicators. And coming to social and mental health indicator is nothing but what here, we'll be having positive and also negative indicators. Positive indicator is nothing but here, we'll be having mental and social pathology that includes suicide, smoking, homicide. So these all will come under due to violence and also crime, road traffic accidents. Juvenile Delensky is one of the court. Okay, so the judgment, so means what, in minor age the boys is going to do the crime, so for that people the court is giving some punishments. So that indicates Julie Delensky. Alcohol, drug abuse, so this all is going to come under the social and mental health indicators. Next, socio-economic indicators is nothing but it is also measures health. So here we can see the include rate of population increase, per capita gross rate, level of unemployment, dependency ratio, literacy rate, especially female literacy rate we can say. Okay, so these all will come under the socio-economic indicators. So this is about indicators we are going to have. And the next question we are going to have the objectives of health education. The objectives of health education is nothing but here we are having some objectives to follow the health education, outcomes of the health education. Okay, so the first one is we are having motivate people to adopt health promoting behaviors. So means what we can say, we'll be having knowledge to improve positive attitude. So means we have to motivate the people to get the good health. Okay, and next objective we are going to have here is assisting people to make resolutions about their health. So means what we can say here, we should keep some confidence and some resolutions into practice we can say. Okay, and also health education will aim here some precautionary and preventive measures that indicates contamination and communicable diseases. Precautionary and preventive measures, these are nothing but here which can improve or help the health standards of society. So next one we are having health education. Health education is also one of the objective we can say. So it is one of the scientific knowledge which we individual manner or family community, it can improve the health education by giving this health education. And next one we are having bad effects of smoking, taking alcohol. So the knowledge should means we should maintain proper health, these all should be abolished. And next objective we are going to have here is understanding how present a rapid development of science and technology. Sorry for inconvenience. Okay, now it is clear I think. So here understanding how people present the development of science and technology. So when we develop some science and technology, it also leads to health hazards and life problems, and that also we have to prevent them. And next one, developing promoting mental and emotional health. So what it requires, physical health is nothing but physically fit, mental emotional health problems, these all will come under the health. And also civic responsibility, develop a sense of civic responsibility. So it's nothing but what his skill does not lie on anyone's shoulder. Okay, so skill health means what, social conditions which require action on the part of community we can say. And also provide information about health and its value as community asset. Okay, so this all is going to come under the objectives. So this is nothing but objectives. And next one we are having food and nutrition board and its activities. Food and Nutrition Board is nothing but FNB here. So under the Department of Women Welfare and Child Development. So it was mainly the food and FNB was situated in 1964 by the Ministry of Food. So by this what we can see here, in 1993 it came into existence of Women and Child Development. It is a country where there is a technical wing at the center we can say. 4 regional offices we are having, and quality laboratories at Delhi also we are going to have, and that is Mumbai, Kolkata, Chennai, and 43 community food and nutrition extension units we are having. That is regional offices which is located in states, UT, and however we will be having community food nutrition extension units in the states Uttarakhand, Tripura, Nagaland, Trivandrum. So these are the states we are having. Lakshadweep, union territories like Daman and Diu. Okay, and also we are having malnutrition So it is one of the phenomenon both for cause and effect of poverty, ill health, clinical, this all will come under this. Proper sanitation, female illiteracy, lack of safe drinking water, ignorance, lack of awareness, and ill health. So everything will come under this. Okay, FNB is nothing but conventional activities, like here we'll be having nutritional education and orientation program, means nothing but what here people in rural, urban, tribal areas. Okay, activities of will come under the primary activities of FNB. Community food and nutrition extension units are organizing nutrition in rural, urban, tribal areas in different states, we can say. So about these activities, 5 lakh people are benefiting, we can say, annually. And training in home scale preservation of fruits and vegetables. Coming to here, to promote preservation and consumption of fruits and vegetables among housewives, adults and girls. Okay, so teaching and training them in home scale preservation also. Okay, and also we can monitor monitoring of supplementary feeding under ICDS. So means what we can say here, monitor the feeding component in areas of the location is nothing but what here, mass media communication, action on national nutrition policy. So mass media communication is nothing but we'll be having headquarters in development of educational and training material on nutrition, and some of the publications here including nutrition education, child health, nutrition mothers, folding on mother's milk, green leafy vegetables, fruits, vegetables, these all going to come under the mass media communication. And coming to national nutrition policy is nothing but here, the government has taken up the rule in 1993 that so some plans should be implemented about nutrition and sanctioned by Interministerial Coordination Committee, which is released in 1995. So to eradicate micronutrient, means to reduce the micronutrient deficiency like vitamin A and iron, so a task force, some members they were constituted and they have worked on it. So then the National Nutrition Mission will reduce the malnutrition in a time according to the year. Okay, so for reducing high levels of malnutrition in the country, so they created awareness campaign in malnutrition and its prevention also. So then by monitoring, mapping, surveilling, so these are the important areas where they have to be implement to decrease the malnutrition. The national nutritional policy has implemented mainly. So this is nothing but FNAB. So next coming to NIN. NIN is nothing but here National Institute of Nutrition. So here National Nutrition is nothing but here it is an Indian public health. So coming to here, Nutrition and Translational Research Center, we can say, which is located in Hyderabad. We can say. So it is one of the oldest research center in India also, we can say. It is a Indian Council of Medical Research. What are the objectives of this NIN is nothing but here to evolve effective methods of management and prevention of nutritional problems through research. Means what happens through methods of management nutritional problems through research, economic, social, administration, and also identify various dietary nutrition problems among different segments of the population, we can see, conduct operational research associated with planning, and also provide training and orientation in nutrition, and circulate health and nutrition information, examine nutritional deficiencies, nutrient interactions and food toxicities at elementary level, merge nutrition research with other health programs, we can say, and advise government and other organizations, we can say, to integrate the institute research programs with other health, agricultural and economic programs also. So these are the objectives we are having. And coming to activities, so the activities is nothing but here establishment of dietary references like values, recommendation, dietary allowances, dietary guidelines, Indian population. So these are the activities we are having. And it also we are having individuals, intake of individuals, households, about nutrition in 10 states. And also they have developed a nutritional surveillance system to serve an early warning system about nutritional problems. While doing survey, what happens here, we can solve the problems. And also there are some strategies to pregnant ladies who are in rural areas. Okay, so for that also they implemented some strategies and also demonstrated tricuspid parental islet transplantation technology in primates and rodents. In insects we can say. Okay, so these are the activities we are having. And also so we are having fortified salt is nothing but tata salt plus priced at an economic rate. Yes, no, iodine plus some fortified salts. So the salt indicates, we call it as fortified salt. So then we are having database on nutritional values over 650 Indian foods, and also periodic assessment of nutrition intakes will be having, and started growth norms for Indian children, and also emphasize the importance of growth we can say, and also formulated recommended dietary allowances we can say. So these are the activities we are going to have in NIN. So next we are having National Health Policy NHP. Okay, in 2017 it was implemented. We are having certain principles. Generally what is this is nothing but here the health is, as we know, physical, mental, social well-being in the absence of diseases, or when policy is system will be having to make decision for the achievements, right? So health policy of a nation is a strategy to control or optimize the social uses of health knowledge. Okay, so means how to use that one we'll be getting. So then coming to here, Ministry of Health identify the need for policy arising day-to-day problems which is related to various health programs and the commitment to achieving the goals of HFA. So India has adopted first national health policy, that is in 1983. So, and followed by the second national health policy 2002. So both have served here in 5-year plans. So these are the principles which was implemented in 2017. So first principle is professionalism, integrity and ethics. So here highest professional standards, honesty, morals, it should be maintained, okay, in a professionalism entire system of the health. So and also in the country also we have to maintain, according to environment also we have to maintain. Universality is nothing but here avoidance of social, economical, current health status, that is in the background systems also we should have to avoid these all. Equity is nothing but here reduce inequity, mean confirmatory action to reach the poorest, means what we can say, gender, poverty, caste, disability, so it should be reduced, then only our health will be also good. Affordability is nothing but as cost increases automatically the poor people cannot take, only rich people can take everything. So means what, at that time also the health is getting the reduced. So then what we can say here, household healthcare expenditures, like health expenditures exceeding 10% of its total monthly, instead of 10% will be undergoing 40% of monthly non-food. So by this also, without taking the proper food items, we'll be getting health issues. And also we'll be having accountability is nothing but financial and performance accountability will be having, transparency in decision making, eradication, so this all will come under the accountability. And patient centered and quality of a care is nothing but here gender sensitive, safe, convenient healthcare services, so these all should be provided confidently. And inclusive partnership is nothing but stakeholder is important, and partnership and participation of non-health ministries, communities, so this all will come under the partnership. Pluralism is nothing but here patients who chosen this one, Ayush care providers based on documents, okay, local, home, community, so this all will come under the pluralism. Decentralization is nothing but decision making to its practical considerations, and also community participation in health planning, this is nothing but decentralization. And coming to dynamism and adaptiveness, dynamism is nothing but here healthcare based on new knowledge and evidence with learning from the communities we can say. So these are the principles of the NHP, National Health Policy. Okay, and let us see the next question. It is nothing but here Rashtriya Bala Swasthya Karyakram. So is nothing but here is a new initiative, we can say early identification for age 18 to 4. Here defected birth, deficiencies, diseases, development delays including disability. This all will come under this Rashtriya Bal Swasthya Karyakram. So it is important to note what means here 0 to 6 years age will be especially managed at district early Invention Center, while 16 to 18 age group management of conditions will be done through existing public health facilities, we can say. So these are the linkages we are going to have, and the first level of screening is done medical officers, staff nurses and ANFs. After 48 hours 6 weeks, the screening of newborns will be done by ASHA at home as a part of HBNC package. Outreach screening will be done by mobile block level teams for 6 weeks to 6 years at Anganwadi centers, we can say, and 16 to 18 years children at school. Once the child is screened and referred from any of these points, so we can see the treatment interventions and target age group. The services aim to cover 0 to 6 years of age in rural areas, urban slums, in addition to children enrolled in classes also. So here also we can see the services 27 crore children is in a phased manner, and also we can see the age group and also beneficiary. Okay, so these are the things categories. If you have been seen, we are going to have babies born at public health age group 6 weeks, estimated coverage 2. Preschool children in rural areas will be having 6 weeks to 6 years, 8 crores. School children enrolled in class 1st and 12th, government aided school 6 years to 18 years, 17 crores we are having. Okay, so what is the mechanism of this screening community here? So the mechanism is nothing but here child screening under RBSK is 2 level: community level, one is facility level. Community level and facility level. While coming to facility level, it speaks about newborn babies like PHCs who is suffering from, means the health facilities we are having like PHCs, CHCs, DH. Okay, so health manpower like medical officers, staff nurses, ANMS, and the community level screening will be conducted by the mobile health also, by Anganwadi centers. And coming to screening at Anganwadi center, it's preschool children below 6 years of age would be screened by mobile block health teams for deficiencies, diseases, we can say. 0 to 6 years supported by pictorial and job aids we can take. Okay, so these are the things. And screening at schools and government, we can take it as 6 to 18 years, screened by mobile health terms like deficiencies, developmental delays, and also through adults and health at local schools. At least once in a year we have to do screening, and we have to use questionnaire and clinical examination. Okay, and the composition of mobile health team is nothing but here Ayush, the doctors, one male and one female, at least one bachelor degree from a institution should be appointed here, and nurse and staff is also appointed for this team. Okay, so this is nothing but RBSK. And coming to different types of health, so we'll be having different types of health depending upon family, depending upon food, depending upon medical care, depending upon social issues, environment, job. So we are having some different types of health, that is physical health, mental, social, spiritual. So these all depending upon the old health organization, different health problems we are going to have. So coming to physical health, we are mainly here body parts we can take. Okay, so mainly here in our body, proper functioning of the body, so means by physiological functions properly work with hormones. The physical health is nothing but mainly work with hormones, weight, age, height, and shining eyes. So this all will come under the physical health. And coming to mental health is nothing but here adjustment and surroundings around this society, what happening. So it also affects our health, day-to-day events also affect our health. So balanced feelings, ambitions, and also accept the realities of life, face some confidence in oneself, cope with normal stress of life, sensitivity towards needs of others. This is all mental health. Okay, Coming to social health is nothing but adjust with the other people. Okay, feel sad when somebody close to pass away. Okay, so this is nothing but social health. Get along well with others, having a pleasing personality. Okay, and coming to here, accomplish responsibility duties towards others, optimistic approach towards life, express disagreement positively. So these all will come under the social health. And spiritual health is nothing but individual which reaches out and strives for meaning, means purpose of life. Psychology, physiology, we can say here absence of health is denoted as disease, illness and sickness, we can say. So this is nothing but spiritual health. And coming to here, principal goals vision of national rural health mission, next one. So national rural health mission is nothing but here, which is launched in the year 12th April 2005 to provide accessible, accountability, affordable, quality health services to poorest household in the rural regions. Means in rural regions, poor people will be there, no, to provide them complete health details. This policy, this mission was introduced in 2005, that is in 12th April, we can say, with different areas. Okay, so the challenges we are going to have over here is integration of sanitation, hygiene, nutrition and drinking water needed in overall sector, and also striking religion inequalities, challenge of population we will be having according to demographic indicators, and also undue importance of curative services, we can say. One spent on poorest 20%, 10% Indians have health insurance also. So these are the challenges we should have. Coming to principles, promote equity, efficiency, quality and accountability in public health systems, and also enhance people orientation, band community based approaches, ensure public health focus, recognize value of traditional knowledge, promote new innovations, methods, process, and decentralize and involve local bodies. And goals we are having under this mission is here infant mortality rate and also maternal mortality rate reduction, universal access to public health services like women health, child health, water, sanitation, and also prevention and control of communicable, non-communicable diseases, access to integrated comprehensive primary health care. Also we are going to have the goals. Okay, and the vision we are going to have over here is to rural population throughout the state, and also include public spending on health with increasing arrangements, undertake architectural correction of the health systems, and also effectively integrate of health concerns, set time bound goals and report publicity of progress, improve access of rural people, especially poor women, we can say, revitalize local health tradition also. So these all will come under the vision. Okay, and coming to next one, plan of action for national rural health mission. So for this, what is the plan it is going to have means 10 components we are having. In component 1, asha is nothing but accredited social health activities. Every village means large habitat, means 1000 population will have a female community, means for 1000 people one female will be having. So which is chosen by the panchayat officer, we can say, and the community public health care system. Okay, so it is a woman, she is a woman, village married or widow or divorced, and in the asha, so the age will be 25 to 45 years. So she should be literate woman with formal education up to 8th class with communication and leadership qualities. So that come under the component 1. And coming to component 2, strengthening sub centers is nothing but here fund, it is giving the fund like 10,000 per annum. So joint account on ANM and panchayat sarpanch, you can say. So mainly drugs, essential drugs, allopathic Ayush to the sub centers. In case of additional outlays, mail and additional AMNs whenever needed. Means some people will come and will give the tablets. Those will come under the strengthened sub centers. So as per 2001 population, it is existing in sub centers, building for sub centers also. This is component 2. Component 3, strengthening primary health centers is nothing but PHC. Means here primary health center we call it as PHC. So for quality, preventive to supervisor of outreach services. So these people are required here. Okay. And next we are having strengthening of CHSs. CHSs is nothing but community health centers from 30 to 50 beds at 24 hours will be having. So new Indian public health standards will be having, and also stakeholder committees for hospital management. Infrastructure also will be having, developing standards of services, cost in hospital care, and develop display ensure compliances, and also case of additional outlays, creation of new community health centers to meet the population norms we're going to have. And next component we are having district health plan. So it is nothing but amalgamation of field responses through village health plan, state, national priorities of health. And health plan would form the core unit of action proposed, also water supply, sanitation, hygiene. And district becomes core unit of planning, budgeting and implementation. And centrally sponsored schemes could be rationalized. Concept of funneling funds to district medical health and family welfare programs it should have. Provision of project also it should have. Component 6 is nothing but converging sanitation and hygiene under NHRM. Is nothing but sanitation campaign, we can see it is implemented in 350 districts to cover all district in 10th plan. So it includes ICE activities also, including household toilets, women's sanitary complex. Means in our areas only festival time the people will come for money and they will do some sanitations and they will go, right? Next we are going to have national disease control programs for malaria, strengthening diseases programs. Okay, surveillances, new initiatives is launched for control of communicable diseases. Okay, village level, and also Ayush. So these all will come under the strengthening diseases. And coming to public private partnership for public health goals is nothing but 75% of health services are currently approved by private sector, we can say. District institutional mechanism for mission also. And also here it need to develop some guidelines for public private partnership, and also management plan for PPE initiatives at district, state, national levels we are going to have. Next we are going to have new health financing mechanisms. Task group is nothing but some members were appointed here in hospital care. So it's nothing but here it hospital serves by way of reimbursement, money follows the patient here. And also some standardization of services national expect. So it will monitor the hospitals mainly. Okay, so and the last one is reorienting health or medical education to support rural health issues. Is nothing but what medical, paramedical education facilities, we can say, it should be created in states also. And suggestions for commission for excellence in healthcare. And also task group is improved to guidelines and details. So this is nothing but plan of action for national rural health mission. And next the next question is here, urban healthcare delivery model is nothing but here it is an urban is nothing but primary healthcare with outreach and referral linkages, we can see. Sorry for disturbance. So here urban community healthcare center is nothing but population norms and location we are having. So it may act as nearly hospital for every 4 to 5 PHCs, primary health case, and also community healthcare population of 2,50,000 we are having. And services is nothing but patient services, 30 to 50 bed facility, medical care, minor surgical facilities we are having, institutional deliveries. Okay, and support staff should be provided, that is 2 doctors, 1 regular and 1 on a part-time basis. There are 2 multi-skilled paramedics also, one is lab technician and pharmacist also. And nurses also is having ANFs depending upon the population covered. And the clerical and support staff also should be there depending upon the hospital. Okay, community mobilization. And next one we are having urban primary health center is nothing but here population of around 50,000 to 60,000. So is nothing but slum areas we are going to have half a kilometers which is population of 25 to 30,000 with OPD from 12 to OP. We will be saying OP, no, 12 to 8 in the evening. And coming to here, cities based is nothing but here 75,000 for areas with high density we are going to have. Next, services for this is OPD is nothing but consultation, lab diagnosis, drug contraceptive, disturbance of health education, material and counseling for all communicable and non-communicable diseases. It will not include in patient care also. Next, coming here, support staff. Support staff is nothing but here 2 doctors, 1 regular and 1 part-time. There will be 2 multi-skilled paramedics like same, and 2 multi-skilled nurses, and also clerk and support staff should be there. For 1 program manager should be there. Okay. So, and community level USHA is nothing but urban social activities. So it is a slum area. It is also community similar to an NRHM, we can say. The years women should be there here for the age group of 25 to 45 years, and they should cover 1000 to 2500 community level beneficiaries. Okay. And this is the, so there will be cover between 200 to 500 households she should cover. So the USHA should cover Anganwadi center also, a slum layer doorsteps should serve as the demand generating links also, and also maintain interpersonal communication skills, and also ANM is delivering outreach services and also responsible for Mahila Arogya Samitis also. Coming to selection process, it will be selected through community process by urban local body. So by the district city level mission, they will be selecting this USHA. Mentoring system, coming to mentoring systems, will be having here volunteers, professionals through local NGOs. Okay, so this is nothing but USHA. And coming to services of USHA is nothing but here good health practices, community support, facilitate awareness also, gender equality, and also early registration of pregnancies. These all will come. And also formation, promotion of Mahila Arogya centers, arrange escort. Okay, these all will come under the services. Next one we are having Mahila Arogya Samiti. Mahila Arogya Samiti is nothing but here interpersonal communication. It will interact with 2 communities. So, and also here surrounds around 50 to 100 households. And the activity here is prevent and promote healthcare, facilitating access to identified facilities. And the constitution is nothing but ASHA, women's and SSG groups. Auxiliary nurse, we are having minimum of 1 outreach section in area of mass every month. We can say outreach medical camps we are going to have once in a week, and 4 to 5 ANMs will be posted in each, and outreach sections will be planned to focus special attendance for reaching out to the vulnerable sections. Okay. And next question here, what is the objectives? The objectives we are going to have for health policy in 2017 already we have seen, but once again we are saying health status and programmed impact. Means increases life expectancy at birth from 67.5 to 70, mortality by age and or cause, reduction of disease prevalence or incidence, like 2020 HIV target. Okay, for HIV AIDS. And also we are having it achieves, maintain, elimination status of leprosy, achieve and maintain a cure rate, and also prevalence of blindness, premature mortality. So these all will come under the objectives. Performance, coverage of the health service, cross-sectional goals related to health system strengthening is finance, infrastructure and human resource management, information also. Policy trust includes here ensuring adequate investment, prevent to promote to health, and organizing of public health care center. So different national health programs is nothing but here health programs we are having Janani Sishu Suraksha Karyakramam, and also Rashtriya Bal Swasthya Karyakramam, Rashtriya Kishore Swasthya Karyakramam, Mission Indra Dhanush, Janani Suraksha Yojana, National Program for Family Planning we are going to have. National Nutritional Programs is nothing but here iodine deficiency disorders, child development services, midday meal program, nutritional iron plus initiative, nutrition vitamin A. So these all will come under the nutritional programs. Communicable diseases is nothing but leprosy eradication program, vector borne diseases, rabies control program, AIDS control, pulse polio, viral hepatitis we can say. Non communicable will come under the tobacco control, mental health program, and also Pradhan Mantri National dialysis program also we are having. And the next we are having health system strengthening programs is nothing but Ayushman Bharat Yojana, Pradhan Mantri Swasthya Suraksha Yojana, Lakshya program, National Health Mission. So these are the things we are going to have. Next, we are having core activities of World Health Organization. What are the activities we are going to have over here is nothing but mainly these are the Geneva, Switzerland headquarters, 150 field worldwide we can say, 12th January 1948. Okay, so coming to here is staffed by health professionals, leadership on global health matters, and engaging in partnership where joint action is needed here, and shaping the research agenda, stimulating the generation, translation, setting norms and standards, and promoting, monitoring their implementation we are having, articulating ethical and evidence-based policy options we are having, providing technical support to countries we are having, monitoring health situation and assessing health trends we are having. Core functions are set out in the 11th general program we can say. Okay, and coming to objectives of IDA. IDA is nothing but India's some national. So 1962 here we are having minded nutritions, dietitians, workers, which is associated with health fields related to scientific body also. Nutrition in the maintenance of health in the prevention and management of these diseases also we are having. Here Indian Dietetic Association like DC Gopalan as president here and Kalyan Bagchi as secretary, and it is International Congress of Diabetes we can say in 1975. IDA is located in Kolkata, held in 2012 at Hyderabad. Okay, so every year 10th January is observed a diabetics day. A theme is decided every year and all chapters take active part in spreading the message of nutrition and diabetics we can say. And here the objectives of diabetics we are going to have Indian Diabetic Association, we call it as IDA. In 1963 it came out in December, and also here these are the issues which are published every year also. And coming to objectives, to promote the cause of science by encouraging spirit of active pursuit of knowledge and original scientific research, safeguard the interest of scientific generally, assist social, scientific and cultural fellowship, support close contact interaction between persons following different branches, and thus facilitate the development of a wider outlook and the integration and application of the available scientific knowledge we can say. Okay, and coming to here RMNCHA, so reproductive and child health program. So it is launched throughout the country on 15th October 1997. So status in which women will be regulate their fertility we can say, pregnancy, childbirth, safety, and pregnancies will be fruitful and survival mother and child. Okay, so the couples will also able to have their sexual relation from the pregnancy and of STDs. 2013, and it essentially looks to address the major cause of mortality among women, children, as well as in delay in assessing and utilizing healthcare services. So here RMNCH strategy has been developed understanding of continuum of care to guarantee equal focus on various like stages, that is also scorecard to track performance, national iron initiative. Okay, so and also objectives we are going to have over here is reduction of infant mortality rate and reduction in maternal mortality ratio, reduction in total fertility rate, and also reproductive, maternal, newborn, child and adolescent health also. So by improving the maternal and child health and the survival are central for this achievement of the national health goals under include national health submission. Sustainable development goals also includes the focus on reducing maternal newborn child mortality rates here. Okay, so the government of India take action, that is call to action summit in February 2013. So the Ministry of Health and Family Welfare launched here reproductive maternal newborn child plus adolescent health education. So RMNCHA is nothing but a reproductive maternal newborn child plus adolescent health. So which is a key tool for decreasing maternal and child illness for the determinant rates. So and also it is a reproductive maternal newborn child. We can take the key strategies. It includes here postpartum and post abortion family planning services, basket of family planning choices, contraceptives by ASHA workers, fixed day static services at all facilities, increase compensative scheme, national family planning indemnity scheme. So this all will come. Coming to maternal health, timely registration of pregnancy, encouraging institutional deliveries, improving access, we can say ANC services, we can say maternal death analysis, complete abortion care, and maternal and child health wings we are going to have. And next one we are going to have national herbal health mission. That is goal we are going to have here is urban population, particularly poor, other disadvantaged sections we can take here. So coming to here, mission of the high focus mainly population which is listed and unlisted slums, all other population like homeless, rag pickers, street children, rickshaw pullers, construction, brick and lime, kiln workers, sex workers, and other permanent migrants, we can say. Public health trust on sanitation, clean drinking water, vector control also we are going to have. And next we are having strengthening public health, all existing CHCs which is having waste component also, so on monthly basis, and district health accounting system we are going to have, and advocate technical managerial accounting support is also having. Central government will provide subsidies and IRDA will be approached to promote such CHBS also. And some strategies, core strategies we are going to have over here is improving the efficiency of public health system. So it is by strengthening, revamping, rationalizing, okay, and promotion of access to improved healthcare at household level through community-based groups, Mahila Arogya Samitis, strengthening public health through innovative, preventive, and promotive action, increased access, okay, and IT-enabled services, capacity building of stakeholders, prioritizing the most vulnerable, and also ensuring quality healthcare center, okay. And next, pre-conception and attentional care package is nothing but here adolescent pregnancies have a high risk of give birth outcomes, 50% increases risk, and stillbirth is nothing but here the death the child in a mother's womb, that one we call it as stillbirths. So and also complications will occur during labor and also delivery. So these are all the risk factors under maternal conditions. So iron deficiency is also one of the factor. Iron deficiency is less, anemia, other micronutrient deficiency, numen, calcium. So this all will increase the birth of the children. So interpregnancy less than 12 months or longer than 60 months have been linked to adverse paternal. And coming to here, importance of this is nothing but here some few silent, that is prevention, treatment of malaria, syphilis is one of the sex disease, and treatment, increased emphasis on detection, prompt complications, and these are the things it is going to occur the pre-conception diseases, okay, for newborns. These are some of the diseases we are going to have. Family and community outreach sub-centers and health facilities we are going to have here. If you have been seen here, this is the table we are going to have what are the diseases post and pre, okay. And priority actions we are going to have over here is delaying age at first pregnancy, okay, stakeholders with other departments on teenage pregnancy, very in small age pregnancy we are going to get, and also here planning services and saturate high casehold facilities to provide PPICD and also advocate members of ANMS, nutritional interventions, so strengthening convergence, screening of high risk pregnancies, accelerate implementation of preventive measures, counseling and birth preparedness. So these are the things we are going to have. And next one, we are having care during labor and childbirth package. So quality care during labor childbirth is an post-anal period of complications, we can say here. So early detection, we can say coverage of institutional births, and also here period of key factor, we can say. Okay, so provided an opportunity, we can say infection death due to intrapactum complications, births remains a challenge to the neonatal survival, we can take, and potential to reduce stillbirths also. It is emphasized to that B can reduce intrapattern. Okay, so 40% we are going to have. Okay, so smaller effect, that is 25%. So growth, reduce disability, non-communicable diseases, and also here neonatal deaths by 31% we are having, which is reduce the need of special care newborns, and also antibiotics. It also prematures and clean birth practices, soap and water by birth attendants will be having. CPCs in births at home 15%, facilities 27%, and post-anal period here 40%. Here the table we will be having, see, skilled birth attendants, clean birth practices, identification of complication and timely refer to pre-referral dose we are having, emergency obstetrics, management of maternal. Here actions we are going to take over here is public health facilities at levels for conducting safe delivery, dedicated MCH delivery points to be saturated here, and we are having availability of SPA trained birth, and also quality assurance mechanism, institutionalized reference mechanism, and also accelerate scale up of new policy decisions, develop mechanism of supportive awareness on JSK. So and also surveillance system we are going to have. And next one also immediate newborn care package we are having. The newborn baby, about newborn baby, how it is drying, stimulation, warmth, hygiene care, early intimation of breastfeeding. So these all will come under this. Here administration of vitamin K and babies which do not breathe at birth. Okay, so rescuation is a life-saving intervention, we can say, which is one of the factor we can say we should be taken, prevent and manage this all. So those are the things we are going to take. Newborn, immediate newborn care, we have to give this some preventions, and these are the actions we are having. And also this is nothing but care of healthy newborn package, same thing by ASHA workers, and these are the things which has to be prevented, and what are the actions we have to take. Okay, for sick newborn package also. Okay, newborn survival package, Rashtriya Kishore, this already we have seen. Epidemics and pandemics, what is epidemic, what is disaster management act. So epidemic is nothing but here increase in the number of cases, diseases, nothing but here epidemic. So is nothing but unfine balancing spikes in case numbers due to environment. Okay, malaria, this all will come under this. Pandemic is nothing but spread over nutrients, which is one type of new disease which is coming. Flus, mainly flus we can say. Okay, so this is nothing but pandemic. These are epidemic and this is nothing but pandemic. And disaster management, as we know, national disaster management we are having. these are the features we are having: authority, executive committee, state disaster authority, district disaster management authority, response force. So these are the things we are going to have. So this is nothing but health unit, and next we are having hygiene unit. Okay, later we can discuss. Thank you.